If you're suffering with joint and muscle pain, then you can try Kinesio Taping techniques. You need to ensure that you apply the techniques correctly. So let me demonstrate. If you haven't heard of Kinesio Taping, you've probably seen it. Kinesio Taping is a special form of tape that actually helps to lift the tissues off the area of injury. It works by actually helping to support the joint, in this case around the knee joint where there's been tension around the kneecap, but pain around the base of the knee itself. What the tape is going to be doing when we apply it is actually supporting the knee joint by going around, and then we'll be applying a small, what we call a decompression strip, that actually helps to lift the tissues, and by doing so that actually lifts the skin and therefore pressure off the pain sensors. So that is actually what's doing the work to help with the pain relief. What the tape also does is because it's elasticated, it actually helps to lift the tissues around the knee joint, and that also helps to actually alleviate any buildup of fluid by opening up the spaces within the tissues and allowing the fluid to move, whereas something which would have been strapping the joint to stabilize it is okay, but actually that is compressing the joint. So the reverse is actually what's going on with this type of taping. So it's both providing support, but it's actually lifting the tissues. So it's actually encouraging the movement of fluid, so you don't get the build-up of fluid which creates the pain around the knee joint. So what we would do with this type of tape is that we'd cut it into strips, but we'd also need to round the edges, because that way the straight edge might otherwise catch. So we would actually be able in this way to make sure that the tape can stay on for longer, and it can stay on for up to 6 or 7 days in fact, which actually helps to not only with the rehabilitation of the knee, or the joint in this case, but it also continues the work beyond the activity that you are needing to use it for. How we would apply it actually is to secure the tape above and below the knee joint. So what we'd do is to tear the backing strip. So that's quite easily done. We'd stretch the tape, and because it's elasticated, it allows us to stretch it back, and that opens up the backing paper. We need to be very careful to avoid touching the tape itself. So if we lift the knee joint so we can put the knee under stretch, and we'd actually secure the tape above the knee, and that's the anchor point which we'd use the smooth surface of the paper backing to secure. That's put down without any stretch. We then fold the paper back so we've got the anchor point there, but this time what we'll be doing is actually you can stretch the tape to about 100%, that's full stretch, but we actually go back to about 75% or so in this case. What we don't want to do is to avoid overstretching the tape, because when you come to move, then the tape doesn't have any flexibility, any stretch in it to allow that movement. We want to allow the movement in the tape to work. So we'd wrap that around and following the line of the tendons and ligaments, and then just lay the end of the tape flat without any stretch, and that helps to secure it below the knee. And again, just rub all that down. This actually helps to activate the glue on the tape and to make sure that it actually holds. So give that a good rub down to activate the glue on the tape. And we do the same on the other side. So again, following the line of the muscles and the tendons around here. So again, secure the tape on one side, pull the backing tape back, holding the edge, and again it's a 75% stretch around the joint, and then secure it below the knee. So again, activate the glue to make sure the tape is secured. And then we apply a smaller strip. This time we'd actually tear the backing paper in the middle and then pull the backing off the ends, and then we've got two ends at the end without touching the tape. And this time we'd actually want to stretch it to more or less 100%, and this actually acts to decompress the area of pain, which is where, in this sort of instance, the pain is often felt at the base of the kneecap itself because of the tightness in the muscles up and around the knee joint itself. So what we're doing there is to secure the tape. Again, no stretch at the end. You just lay that down, rub the ends to activate the glue, and again, no stretch on this end. And that's securing the base of the kneecap there. So again, if you were to lift that leg down, you'll see there that the knee and the area around it is already is crinkling, and that's the elasticated effect of the tape. So what that's doing is actually it's lifting the tissues, and that's not only giving you the support around the kneecap, but it's also then lifting the pain off the end of the ligaments and tendons around the knee. So this way you'll hopefully be able to work and play any sport using this type of taping technique on this knee. So as you can see, it's fairly easy to apply, but I will say again that it's important to get it right for it to be effective. You don't need to put up with pain. We offer a free consultation to assess your injury and work together to develop a treatment plan to suit your needs. For more information, give us a call.